Welcome, Cloud members. Thank you for joining us for this week's Zoom session. These weekly videos are hosted by our clinicians on a number of topics related to your health. Each session that we do will include a presentation on a topic, followed by a Q&A during which you can ask questions along with other Cloud members. To see the upcoming webinar dates and presentation topics, look on the events page of our website. These sessions will also be recorded and viewable later by clicking on the live recordings archive page in the media section of our website. Today's topic is understanding your microbiome using the GI map as a diagnostic tool, and it's led by Lindsay Chesley, one of our nurse practitioners. So to give you a little overview of how this session goes, during the presentation portion of the session, which is the first 15 to 20 minutes or so of the session, all attendees are welcome to submit questions for our hosts to answer during the second portion of the webinar session. So if you look at your Zoom, you can find the Q&A icon on the bottom menu of your Zoom screen. Then you click on Ask a Question, which you can then submit with your name or you can submit it anonymously. And then at the end of the presentation, we will group the questions that are similar together so that we can answer as many questions as possible. And I'll be the one who's fielding those questions. My name is Lauren. I'm the membership coordinator here at Cloud, and I'm here to answer any questions that you have beyond this session today. And I'll get us started with our session and I'll launch in with Lindsay. And then over the course of her presentation, I'll be asking a couple of questions just to have this be a back and forth conversation. And then again, please send any questions in during the presentation and I'll field those during the end as well. So to get us started for our session today, I'm going to ask Lindsay our beginning question and then we'll move through her presentation. So Lindsay, welcome. I'm going to ask a big question just to start us out here. Can you tell us what the GI map is?
Yeah, so the GI map was initially...
Ooh, I'm going to turn you off mute because at the moment, oh, maybe we can't hear you. I think we're good now.
Can you hear me? Okay. So the GI map is really an innovative clinical tool that measures, initially and broadly speaking, the microbiome of our gut. So all of our normal bacteria, any opportunistic bacteria, a multitude of things. And what kind of makes this test so special is that the results can be derived from a single stool sample, and they use state-of-the-art qPCR technology, which is more specific than regular PCR testing. And I know we're all familiar with what PCR testing is with COVID tests, so this is even more advanced than that. It was designed to detect microbes that may be disturbing our normal microbiota or normal microbial balance that may be contributing to an illness, as well as indicators for our digestion, absorption, inflammation, and immune function.
So after that awesome, simple explanation that's so understandable, then so intrigued, can you tell me how I would know if I needed to get a GI map test?
Sure. So really, almost every person or patient could benefit from a GI map. When we think about gut testing overall, we often think like if our GI system is normal and we don't have issues like constipation, diarrhea, bloating, things like that, that we don't need a GI map. However, there are a multitude of conditions that could warrant GI map testing and kind of help in treating those conditions. And some of those include autoimmune diseases, brain fog, skin problems, mood disorders like depression and anxiety, diabetes, and even weight loss issues. And then, of course, it does help us in determining treatment and diagnosis for GI-related issues such as, irritable bowel, diarrhea, bloating, constipation. And it really can be performed on anyone of any age, so children and infants as well.
Are there symptoms that someone would experience that you would hear and say that's more likely that you would want to do a GI test than it sounds like you have food sensitivity or something else like that?
Sure. Yeah. So if we have patients, and this happens a lot where patients, are on our schedules and they're saying they're having GI related issues and, it sounds like maybe it's a food sensitivity, maybe not. And so, this test is obviously, not one of our cheaper tests. Food allergy testing is not all that cheap either. And so lots of times if I can't distinguish based on the history that it's a definite food allergy, I usually recommend a GI map. And the reason for that is that the GI map obviously is looking at all of the things related to the gut, but there are a few specific markers that can be elevated, which would be an indication of food allergies. And if that's literally all that's elevated, then, on those results, then I would recommend moving forward with food allergy testing.
If I were to do the GI test, I get my results back. What is it going to tell me? What are these results going to say?
Sure. So the GI map report is usually a total of 5 pages, and the first page covers pathogens, and that's viral, bacterial, and parasitic pathogens. This would be things like C. diff, E. coli, Giardia, norovirus, adenovirus, things like that. The test also looks at H. pylori, and H. pylori is a bacteria. Recent studies have shown that it's in nearly 50% of the world's population has H. pylori in their stomach, esophagus, or mouth. A lot of people are asymptomatic, but it is, a cause for stomach cancer, chronic gastritis, which is inflammation of the upper GI system, and stomach ulcers. It also tests for your commensal keystone bacteria. So these are the bacteria that we want to be present at optimal levels, because that helps defend not only our gut, but our entire body from other pathogens or opportunistic bacteria or things like that. It also tests for those opportunistic overgrown microbes. And so a lot of patients will show elevated levels of some of the opportunistic overgrown microbes and be asymptomatic. But in people who are immune compromised, it really can be detrimental to them when these opportunistic bacteria are elevated. It can be, that particularly can be related to poor diet or antibiotic use, which is something, a lot of people can resonate with. And also a weakened immune system. The test also looks at fungi and yeast. So we know that fungal organisms are really commonly found in the human digestive tract, but fungal overgrowth just causes a plethora of issues. It also looks at parasites. This would be things like protozoas as well as worms. And then I think one of the most valuable parts of this test is the section on intestinal health markers. And I think the reason why it's so valuable is because it gives us a very wide range of your gut activity and how your body is digesting and things like that. And so in those intestinal health markers, there's a marker for fat in the stool, which tells us if you're breaking down and digesting food the way you should. There's a pancreatic enzyme in the intestinal health markers, which gives us kind of direct pancreatic function. There are 2 markers for inflammation. One of those deals with unfavorable metabolic changes or dysbiosis. So if your normal bacteria is kind of back and forth. And then also looks for occult blood in that stool sample you provide. And then one of the biggest things is the secretory IgA, and that marker is a marker for our immune defense in the gut, kind of our first line of defense for both GI and respiratory tract infections. This marker is very heavily influenced if you have a lot of food allergies, or if you just need general immune support. Lower levels of that can be a sign of, microbiome imbalances or even adrenal health issues. And then the next marker is the anti-gliadin IgA, and that is a marker. Gliadin is a component of gluten, which is the protein found in wheat. Elevated levels can indicate an immune response to gluten in the diet. So that's a really huge indicator, even aside from food allergy testing. If we see a report that literally looks great, except for the anti-gliadin IgA is through the roof, and that just tells us, okay, your gut is really responding from an immune standpoint to the gluten you have in your diet. The next is calprotectin, and that's a marker for inflammation. And then the last one is zonulin. And zonulin, where I think everybody is familiar with the term leaky gut, that's something that a lot of us have heard of. And so zonulin is the protein that actually opens the junction in the gut lining. And so when we see increased levels of zonulin in a stool sample, it's a sign that the intercellular junctions are open and things are leaking, hence the term leaky gut.
When you get the results back and you meet with somebody about what their specific situation is, what are the next steps after somebody gets results? What's your goal and timeline? And do we ever take this test again?
Sure, sure. So, it really depends on what the results show as far as, retesting and treatment goes. Fortunately for the gut, there's a lot of things that we recommend that kind of overlap, right? So if we see that somebody has, kind of some dysbiosis going on, we may recommend a natural antimicrobial that would provide benefit to multiple sections of the test. So it's not always like you have to take 14, 15 different bottles. Sometimes things overlap, which is nice. Usually we don't repeat these sooner than 3 to 6 months. And that's just because this test is so specific that whatever treatment regimen you're giving, you really want to give it time to work and eradicate whatever it is that you're treating before you retest.
Is this a test for something like Crohn's? Would we get an answer for that?
So it won't be specific for Crohn's. There is a marker in the intestinal health marker that's specific to irritable bowel. So IBS, that really, if it's a severely elevated, can be a sign of IBS. But it's not something I would rule out in someone who thinks they have Crohn's, because I think thinking about it from a whole health perspective, whether there's a Crohn's diagnosis or not, you want your gut to be in good shape. So whether you have a diagnosis like that, or are seeking a diagnosis like that, I still think this test would be wise to do, because you could correct all of the things outside of Crohn's, which would ultimately, hopefully make your Crohn's, less severe.
Is there anything that off the top of your head, before I lead into some questions, that you feel like we've missed talking about in an overview, or that you tend to have patients commonly come to you asking about the GI map test?
Not usually. I think the biggest thing is people, making sure that there's not things you need to discontinue ahead of that. And, when you pick up, like, the GI map kit is a take-home kit. And so in that box, when you take it home, it has directions on, discontinuing probiotic like 3 days before. But really, I would say the biggest, I don't really have a lot of questions from patients. I think more than anything, the question is, would it be a good test for me? I think that's probably the number one question I get. And I don't know that my answer is ever no. I think it's just it's a great addition and additive to kind of know, we already do comprehensive blood panels. And so this is just a really great way to offer that comprehensive whole body care, and not neglect the gut, because, fortunately, it's where a lot of stuff starts. It's where our immune system response starts. And so it really is important.
Mm. So you'd absolutely recommend it to anybody, and it's probably good to have a conversation with one of our providers, maybe with you or any of the other providers would be great to talk to about considering this, right?
Yeah, absolutely.
Mm-hmm. Awesome. I do have a question that's been
Okay.
asked by one of our attendees. So in that same vein, would you suggest the GI map test or food allergy testing for someone who has lots of burping, some bloating, is having trouble with mucus, needing to cough after eating certain foods, i.e. dairy or chocolate?
I think if a person can solidly identify the foods in their diet that cause those symptoms, then food allergy testing is the way to go.
Mhm.
If the answer to that question is, well, I don't really know for sure. I definitely know dairy does it. I definitely know chocolate does it, but sometimes it just happens and I haven't had either of those things, then I would probably go the route of GI map first.
Would you ever, because the cost for this test is higher, someone asked the question and I answered it just in the chat, but I'll say it aloud now. The current cost of this test is $395, and then the results take about 3 weeks to get back, 3 to 4 weeks. Would you ever have someone take a couple other steps before they take the GI map test, like food sensitivity maybe, or a food elimination diet, or rather just kind of launch on into this?
Yeah, I mean, I think it really depends. It's very individualized, right? So if a patient comes to you with all GI symptoms and can't identify a source at all,
Mhm.
the GI map is definitely the way to go. Sometimes it's just about kind of helping a patient to identify what their triggers are. And are there triggers, right? Or is this just a general, unhealthy microbiome and we need to do a GI map and kind of correct things?
Mhm.
So, I mean, there definitely are times where we recommend food allergy testing over a GI map, but I think it really just depends on the history of the patient and what symptoms they're having.
Okay. Yeah, if no one else has any more questions, I'm gonna lead into sort of a wrap up here, but we'll still be on for a couple more minutes. Um, what would be somebody's next step? So after watching this webinar, they have their own concerns already enough to be curious to watch this and be present today or watch after the fact. What would be somebody's next steps from here?
Yeah, so I would just recommend making an appointment with one of our providers to
Mhm.
discuss, gut health in general or gut concerns. And
Mhm.
then, because this is a take-home kit, it's something that can be picked up at either of our offices or it can be drop shipped to you. Since it's a home collection kit, it's really nice to have that option for people that aren't close to one of our offices. And then you would submit the specimen and the kit comes with return shipping label that you would just send off, and then obviously Cloud, we get in touch with you once we have the results.
Okay. And then from there, they'd have a review appointment and talk through all of the 5 pages of awesome results with really great data. And then from there, you'll make a plan that's individualized to what you see in their specific circumstance.
Yes, exactly.
Perfect. I haven't seen any other questions come up. It seems like, gosh, I got all my questions answered. Super helpful, incredibly important test. And I just want to make mention how important it is that we offer this diagnostic test at Cloud. And this is just one of many really incredible diagnostic tests that we offer. This one is really potent, really special, really valuable information. And in future webinar sessions, we'll discuss a lot of the other diagnostic tests that we have. And I would say this isn't something that you find elsewhere, right, Lindsay? This isn't something that you'd go to your regular GP and learn about.
Yeah, not usually. I mean, even the GI, physicians that we refer to, it's just not something that's really in their wheelhouse. Just because it's more conventional medicine.
Mhm.
And I think this test offers so much insight into what we can't see from the outside, that it's just so valuable. And so I wish more clinicians used it.
Yeah. That leads me to one more question while we still have some time. Why did we at Cloud decide that we wanted to bring on this diagnostic test, or really any of our diagnostic tests? If you're wishing that other providers would do this, it lends so much to the picture of overall health. How did we source this test? How do we find that this one is specifically the right one? And then how did all of our providers really get the knowledge about this?
Sure. So, I mean, the GI map has been the gold standard as long as I've worked, and I mean, long time. It's been the gold standard. And this company specifically, so Diagnostic Solutions, has been the gold standard.
Mhm.
I think Cloud always strives to provide the most comprehensive, progressive healthcare there is. And unfortunately, I think with, some conventional medicine, it's just doesn't have that preventive, progressive mindset, which results in, not utilizing tests like these that just give us so much information.
That's helpful context. I wish I would have asked that question at the beginning, but that's just also a really great wrap up too of why this is such an important test and why this is such a foundational part of our practice at Cloud, more than just every day. We're looking out for your whole person at Cloud. It's not just when you're sick. We did have another question pop up. Just reading through it myself. Let's see. I'm just going to read it verbatim.
Okay.
If there is 1 to 2 case studies of uncovering an issue and taking a next step based on uncovering and resulting impact a few months later with a change. So I think the question is maybe, do you have examples of when something has been discovered, taking the next step of care, and then what was the result or impact of a change? So maybe a use case story.
Sure. Yeah. I mean, I would say we have a lot of these. So what I would call success stories, right? Where we do a GI map, we find H. pylori, for instance. Whether they go the traditional route of antibiotics and PPIs, which are acid reducers, or they go the more natural route, which is a supplement, a couple of supplements. We've had several cases where they go either route, and then, we recheck the GI map and, at the 6-month interval, and it's eradicated completely. We've had a lot of, secretory IgA, which is the immune marker. We've had a lot of those that are either too high or too low. We, put forth a regimen and then we recheck it and it's vastly improved and kind of back to normal, whether it was low or high. And the same goes for like Candida, which is yeast. So if we see those positive and, there are definitely some things in this test that take a little bit longer to eradicate or take a little bit longer to treat. But yes, I mean, we see a lot of patients who have this test and have abnormalities. And when we recheck with the regimen we've put forth, things are improved.
Mhm. Is the success on the other side of treatment, does that usually will come from just someone feeling better, right? It doesn't take necessarily having to redo this test. It's more checking in after a couple months or whatever, however long you recommend to say, how are you feeling, right?
Right. Yeah. So if patients are feeling generally better, we don't necessarily, say you have to repeat this. I think, there are a few instances like H. pylori where we may say, we should do a follow-up breath test, which has nothing to do with the GI map, just to make sure that we're getting a negative result. The nice thing about the GI map in general is that you can do an entire full kit, which is the price that you gave. But if you say you did have H. pylori and that was the only thing that was, abnormal on the initial GI map, you could choose in 6 months to do the GI map H. pylori only. So it's much reduced in price, but it's the most accurate way to measure for H. pylori. And so you could just recheck that specific test. Now they don't do that with many things, but that is one of the things that they do. And so and I do think that that's probably one of the things in the GI map that would warrant retesting at some point to make sure that it's gone. So it is nice that you don't have to pay, 6 months later, if we're dealing with H. pylori, you don't have to pay that $395 again when everything else looked pretty good. You can just do the H. pylori part and get the answer, which is nice.
Mhm. So helpful. Thank you.
Mhm.
It doesn't look like I have any more questions coming in at this time. So I'm going to recap what comes next here for anybody who missed that, and just a note for the future. So if you've listened to everything that Lindsay has shared, your interest is piqued, you've had some concerns of your own about your gut health, the next step here is to reach out to us, call the office, and set up an appointment and express what you'd like to chat about. We'll get you set up with one of our providers. It can be Lindsay or it can be Vanessa, Dr. Tusak, Dr. Tawa, and then share what's happening with you in that appointment. You can just after that appointment, it can be via phone or in person. You can pick up a take-home kit, which Lindsay explained that this kit you take home with you and then you mail it in. And then when you get your results back, then you'll meet with another provider, either the same provider you met with initially, or you can meet with a separate one, and then we'll work towards a personal regimen of treatment for whatever it is that we find in those results. Thanks everybody for being here. This was such an informative session. Thank you, Lindsay, for sharing all of your wealth of knowledge. And just a reminder to everybody else who is here today that we will be having these webinar sessions every week. Check on our website on the events page of our website to see when the next webinar will be. We'll have these sometimes on Tuesdays, sometimes Wednesdays, sometimes Thursdays. So as that changes, just keep an eye out for future topics, when the webinar will be. And then if you can't attend a webinar live to ask a Q&A, we'll always be recording these to watch for future reference. Thank you all for being here. Thank you again, Lindsay, and wish everybody a good evening.
Thank you.